Have you ever wondered why some men in their 60s seem to carry themselves with a certain confidence and vitality, while others struggle with feelings of inadequacy, loneliness, or even a loss of self-identity? It's not just about aging, it's about how you choose to face it. As we age, our bodies inevitably change. And just like our hearts, our minds, and our bones, our penises undergo changes too. But here's the truth. Ignoring these changes doesn't just lead to physical challenges. It can slowly chip away at your dignity, your self-worth, and the connection you have with your own body. For men over 60, the topic of sexual health is often brushed aside, as though it's something that should no longer be a priority. But that couldn't be further from the truth. Your sexual health is deeply intertwined with your overall vitality, sense of self, and emotional well-being. And that's why I, Dr. Mojit Ka, a urologist with over 30 years of experience, am here today to share something crucial with you. In this video, I'm going to walk you through 5 science-backed practical strategies, simple yet powerful actions that every man over 60 can take to preserve not just sexual function, but also confidence, pride, and vitality. These aren't quick fixes or magic pills. They are habits and practices that empower you to take control over your health and your life. I'll also share a bonus tip that most doctors never mention. Something small but transformative that could change the way you experience your body as you age. But before we dive in, let me ask you, do you want to feel vital, confident, and connected to your body as you age? Or would you rather let it all slip away? Stick around until the end, and I'll give you the tools to make a lasting change, starting today. Now let's begin this journey to preserving your dignity and health, because you deserve to age on your own terms. 1. The importance of staying sexually active. As we age, it's easy to believe that our sexual vitality must fade with time, that the best years are behind us, and we should accept the decline. But let me tell you something crucial. This myth is not just inaccurate, it's damaging. The truth is, your penis, like every part of your body, thrives on use. The more you engage with it, the more it stays healthy. Just as you wouldn't stop exercising your muscles, you can't afford to neglect your sexual health either. When you stop using your penis, your body starts to withdraw its support. Blood flow slows, elasticity diminishes, and over time, tissue can begin to atrophy. This is known as penile disuse atrophy, a phenomenon far more common than many men realize. It's not an inevitable part of aging. It's a preventable consequence of inactivity. Even if intimacy feels impossible right now, there are still ways to keep your penis active and healthy. Whether through intercourse, masturbation, or even the use of medically approved devices like vacuum erection pumps, the act of keeping the blood flowing and tissues oxygenated is essential. Think of it like stretching a muscle after sitting for too long. Without that movement, things stiffen and weaken. But there's more to this than just the physical side. Sexual activity is tied to our sense of identity, confidence, and masculinity. When we neglect this part of ourselves, it's easy to feel disconnected, less confident, and even less human. But here's the thing. By prioritizing sexual activity in whatever form works for you, you not only protect your physical health, you also preserve your sense of self-worth. I've seen men in their 70s and 80s reclaim their vitality simply by acknowledging that their sexual health is worth preserving. And let me tell you, the ripple effect is profound. It's not just about the bedroom. It affects every area of life. These men experience renewed energy, deeper emotional intimacy with their partners, and an unexpected surge in confidence. So don't let the idea of age be an excuse to stop living fully. Your body still has so much to give, and it's up to you to honor it, to keep it active, and to embrace the joy that comes with that. 2. Maintaining proper hygiene. As we grow older, we often become more aware of how our bodies change. And yet, there's one aspect of aging that is often overlooked: penile hygiene. This isn't just about cleanliness, it's about self-care, confidence, and safeguarding your health. Improper hygiene, particularly as we age, can lead to infections, chronic irritation, and in extreme cases, even conditions like penile cancer. I cannot emphasize enough how essential it is to maintain good hygiene as you age. For many men, the habits they practiced in their younger years may no longer be enough. Skin becomes thinner and more sensitive with age, and the immune system becomes less effective at fighting off infections. This means that the same care you took when you were in your 30s or 40s simply won't cut it anymore. You need to adapt and be more diligent. For uncircumcised men, this is particularly crucial. The area under the foreskin can harbor sweat, bacteria, and dead skin cells, creating a breeding ground for infections. Conditions like balanitis, an infection of the glands, and other more serious issues like penile cancer are often linked to poor hygiene. In countries with high rates of penile cancer, inadequate hygiene practices are a leading risk factor. But here's the good news. Proper hygiene doesn't have to be complicated. It's as simple as gently washing the penis with warm water and mild unscented soap. Avoid harsh chemicals or strong fragrances that could irritate sensitive skin. If you're uncircumcised, make sure to retract the foreskin fully and clean the area underneath. And don't forget the importance of thoroughly drying the area afterward. Moisture left in skin folds can foster bacterial or fungal growth. This small routine can make a world of difference in preventing infections and discomfort. And the benefits aren't just physical. When men adopt this habit, many report feeling cleaner, more confident, and in better control of their bodies. This is not about vanity. It's about respecting your body and preserving your dignity. In a world that often overlooks the aging body, paying attention to your hygiene is a powerful act of self-respect. By taking care of your body with the same attentiveness you would give to your heart or teeth, you reinforce your sense of agency. You don't just protect yourself from health issues, you also reclaim a sense of pride and control over your life. It's never too late to start. Your body is worthy of care, attention, and respect. And by prioritizing hygiene, you preserve not just your health, but your confidence too. 3. Avoiding sexual injury. As we age, there's a tendency to feel that our bodies no longer work the way they used to. We become more cautious, perhaps hesitant, even fearful of pushing ourselves too hard or doing something that could lead to discomfort or injury. But there's one area where this cautiousness can backfire: sexual activity. A common but overlooked risk is engaging in intimacy when you're not fully prepared, particularly when your penis is only semi-erect. It may seem like a minor detail, but trying to have sex when your penis isn't fully erect can cause lasting harm. When it's not fully rigid, the penis lacks the strength and support needed to endure the mechanical stress of penetration. This can result in what I call microtraumas, small, often invisible injuries to the blood vessels, erectile tissue, and smooth muscle. These injuries might not cause immediate pain, but over time they accumulate, leading to scarring, reduced flexibility, and even conditions like Peyronie's disease, which causes painful curvature of the penis. I've seen it firsthand in my practice. Many men delay seeking help for these injuries, embarrassed by the issue, only to discover that early intervention could have spared them from much more significant consequences. The good news is that it's preventable. The solution is simple: patience, preparation, and self-awareness. Before engaging in any form of intimacy, it's vital to ensure that you're fully erect. Take the time to focus on foreplay. Use this time to help your body prepare properly for intercourse. If necessary, consider using lubricants or erectile aids to achieve the full erection you need to avoid unnecessary strain. And remember, there's no shame in using aids. They are tools, not a sign of weakness. and they can protect your long-term sexual health. This also means being open with your partner about pacing and the importance of taking things slow. Avoiding the rush can relieve pressure and allow for a more enjoyable experience for both of you. It's not about fragility. It's about being proactive in preserving your sexual health and well-being. By making these small adjustments and ensuring that you're ready, you're not just protecting your body, you're also ensuring that intimacy remains a source of pleasure, connection, and confidence, rather than discomfort and regret. Sexual health doesn't have to be a casualty of age, and with a little patience, you can continue to enjoy it fully, safely, and with the dignity you deserve. 4. Managing pornography use. In today's world, the availability of pornography is just a few clicks away, and it's become a significant part of many men's lives, regardless of age. For some, especially those who face loneliness, disconnection, or widowhood, pornography can seem like an easy, private way to relieve sexual tension. But here's the problem. Over-reliance on pornography can quietly rewire your brain, turning what should be a natural and fulfilling sexual experience into something artificially stimulated and unsatisfying. Pornography, especially when consumed excessively, can condition the brain to respond only to unrealistic, extreme stimuli. Over time, this can desensitize you to the nuances of real-life intimacy. What was once a source of pleasure now feels flat and unsatisfying. For many men in their 60s and 70s, the diminished response they experience to their partner's touch isn't due to physical decline. It's because their arousal pathways have been rewired by constant exposure to pornography. This creates confusion, frustration, and a feeling of disconnect. The good news is that this doesn't have to be a permanent state. By reducing your exposure to pornography, you can begin to restore balance to your brain's natural arousal mechanisms. It's about reconnecting with real, organic intimacy. Focus on creating authentic emotional connections with your partner, or even rediscovering pleasure in self-exploration without the influence of artificial stimuli. This shift is liberating, not just physically, but emotionally too. I've worked with men who thought their diminished sexual vitality was irreversible, only to find that limiting their porn consumption and reconnecting with their partners in a more intimate, genuine way transformed their sexual lives. It wasn't about erasing all desire for pornography. It was about using it less and focusing more on what truly fuels human connection, affection, communication, and shared intimacy. It's important to have open, honest conversations with your partner about your needs and desires. It's not always easy, especially when you've been conditioned to expect instant gratification from pornography. But by embracing these conversations, you create space for vulnerability and deeper connection, both physically and emotionally. This doesn't just affect your sex life, it affects your relationship as a whole. Pornography can often isolate you, creating shame and emotional distance. But by managing your exposure, you invite more intimacy, more connection, and more genuine pleasure into your life. The goal is not to shame yourself, but to empower yourself to break free from a cycle that holds you back from true fulfillment. As you age, desire doesn't fade, it evolves. And by embracing this natural evolution and letting go of unrealistic expectations, you reclaim not just your sexual health, but your emotional well-being. Real intimacy, fueled by emotional connection, is far more rewarding than any artificial image on a screen. 5. The power of lifestyle choices over pills. As we age, it's easy to fall into the trap of thinking that the solution to our physical health challenges lies in quick fixes, perhaps a pill or some form of immediate relief. We all know the allure of a magic bullet. It's a quick and tangible way to feel better, to fix what's broken. But after decades of treating men over 60, one truth has become abundantly clear to me. The most powerful driver of sexual health and overall vitality isn't a pill, it's your lifestyle. When men come into my clinic seeking a way to fix their sexual health, many expect a prescription to solve everything. And while medication can certainly play a role, it's your daily habits, your lifestyle choices, that will truly determine your long-term health. You see, your body is an interconnected system, and what you put into it, how you move it, and how you care for it, all play a vital role in your well-being. Take cardiovascular health, for instance. The health of your heart and blood vessels is directly tied to sexual function. Erections in particular depend on healthy blood flow, which in turn depends on the condition of your heart and vascular system. When you engage in unhealthy habits, like smoking, drinking excessively, or consuming a diet high in processed foods, you're not just damaging your heart, you're compromising the blood flow to vital areas, including your penis. This can lead to erectile dysfunction, ED, which is often an early warning sign of deeper cardiovascular issues, showing up years before a heart attack or stroke. But here's the silver lining. By making a few key lifestyle changes, you can improve both your cardiovascular health and your sexual health. Take one of my patients, a 62-year-old man who came to me frustrated by ED. After a series of tests, we discovered that he had early-stage heart disease. The solution wasn't a pill. It was addressing his lifestyle. He quit smoking, adopted a Mediterranean-style diet, and started walking daily. Not only did his erections improve, but he also reduced his risk of a heart attack. His experience is a powerful reminder that taking control of your health through lifestyle choices can not only restore your sexual function, but enhance your overall vitality. This is the beauty of healthy habits. They have an immediate impact, but their cumulative effects are even more powerful. For example, when you quit smoking, your blood vessels begin healing almost immediately, improving circulation throughout your body. Cutting back on alcohol helps balance testosterone levels, which naturally decline with age, and can even improve sleep quality. Simple changes, like taking a 30-minute walk every day, or eating nutrient-rich foods like leafy greens, berries, and salmon, can make a world of difference. These habits aren't just about preventing decline. They're about enriching your life. I've seen men in their 60s and 70s start walking every day, and they report feeling more energetic, more confident, and more engaged with life. They've swapped out unhealthy habits for activities that bring them joy and vitality. They start sleeping better, feel less anxious, and perhaps most importantly, notice a natural return of their libido. Your body is responsive, and it will adapt to the care you give it. But it's not just about adding healthy habits. It's about removing the things that hold you back. Cutting out unhealthy foods, reducing stress, prioritizing sleep, and staying active can transform not just your physical health, but your mental clarity, your emotional well-being, and yes, your sexual health too. By building a foundation of healthy habits, you stop relying on quick fixes and pills. You take control of your body's future, reinforcing your sense of agency and self-worth. You are no longer at the mercy of your age. Instead, you embrace it, knowing that your best years are ahead of you. Aging isn't about slowing down or giving in. It's about finding new ways to thrive, to live with purpose, and to experience vitality at every stage of life. So start today. Make one small change. Whether it's taking a walk, eating a healthier meal, or cutting back on something that's harming your health. These small steps add up, and over time, they build a life that's not just about surviving, but truly thriving. Bonus tip: sleeping without underwear. Here's a simple, yet surprisingly effective tip that most men aren't aware of: sleeping without underwear. Now, I know what you're thinking. That sounds trivial. But let me tell you, after years of working with men and seeing the impact of small lifestyle changes, I've come to appreciate just how much of a difference this seemingly insignificant habit can make, especially when it comes to your sexual health. At night, your body goes through vital processes of repair and regeneration. During sleep, men experience spontaneous erections known as nocturnal penile tumescence, NPT. These aren't just random occurrences. They are crucial for maintaining healthy erectile tissue by ensuring that proper blood flow and oxygenation reach the penis. But when you wear tight underwear or restrictive sleepwear, you compress the penis during these erections, limiting blood flow and causing unnecessary friction. Over time, this could contribute to discomfort, irritation, and even internal scarring, which in some cases leads to conditions like Peyronie's disease. But here's where the simple change can have a profound impact. By sleeping without underwear, or at least in loose-fitting boxers, you give your body the freedom it needs to function as it was designed. You're allowing your penis to rest and restore itself naturally without the pressure of tight fabrics that constrict blood flow. This simple habit reduces friction, enhances circulation, and supports long-term comfort and function. I've had patients, particularly men in their 60s and 70s, who were initially skeptical when I suggested this change. But after just a few months of sleeping without underwear, many of them reported feeling more comfortable during spontaneous erections and noticed a greater sense of ease in their bodies overall. It's a small tweak that yields outsized benefits, especially when combined with other healthy habits. What makes this tip so powerful is its simplicity. You don't need to invest in expensive treatments or complicated devices. Just remove one item of clothing at night and allow your body to do what it naturally does best: heal, restore, and thrive. This one change, though small, can help you prevent discomfort, maintain healthy erectile function, and enhance overall well-being. So, if you're ready to make a simple yet impactful change, give it a try. Sleeping without underwear may seem insignificant, but it's part of a bigger picture. A picture where every little habit, no matter how small, plays a role in preserving your health and dignity as you age. Your body is capable of amazing things, and by honoring it with these small acts of care, you set yourself up for a lifetime of vitality, comfort, and conclusion, reclaiming confidence and vitality. As we reach our 60s and beyond, it's easy to feel like we've passed our prime, or that we're no longer capable of experiencing the same vitality we once had. Society often reinforces this idea, portraying aging as a time of decline. But I'm here to tell you that this simply isn't true. Aging doesn't have to mean giving up on the things that make you feel alive, confident, and vital. In fact, it's the exact opposite. With a few thoughtful science-backed strategies, you can not only preserve, but also enhance your sexual health, confidence, and overall well-being as you age. The 5 essential steps we've discussed: staying sexually active, maintaining proper hygiene, avoiding sexual injury, managing pornography use, and embracing healthy lifestyle habits, are all about giving you the tools to age on your own terms. They're not about recapturing lost youth. They're about embracing the wisdom and strength that come with age, while still nurturing and caring for your body. And remember the bonus tip: sleeping without underwear. It's a small change that can have a profound impact, but it's part of a larger philosophy that the little things matter. When you take the time to care for yourself, to make those small adjustments in your daily habits, you're sending a powerful message to your body that you deserve respect, vitality, and a life that's full of connection, confidence, and joy. The truth is, your body is still capable of incredible things, no matter how old you are. By making the choice to take care of it, you can unlock a new level of vitality and confidence. It's confidence. Thank you for joining me on this journey. I hope these lessons inspire you to take action today, because you deserve to feel strong, vital, and proud at every stage of your life. Don't wait for tomorrow to make a change. Your future self will thank you for the care you give yourself today.